Hi, this is Sophie here at Hope Pharmacy with pharmacist Sadaka Chow. Today's 10 questions are on propranolol, so let's start. Sadaka, what is propranolol and what conditions is it commonly prescribed for?
Oh, hi, Sophie. Propranolol is a non-selective beta blocker, which is commonly prescribed for hypertension, chest pains, arrhythmias, myocardial infarction, migraine prophylaxis, and anxiety disorders, particularly performance anxiety.
Got it. And how does it work in the body?
It works by blocking beta receptors in the heart and the blood vessels. This action reduces the heart rate, the myocardial contractility, and cardiac output, which lowers blood pressure. It also reduces the release of renin from the kidneys, which further aids in blood pressure control.
I see. What are the standard dosing recommendations in treating hypertension?
The usual initial dose for hypertension is 40 milligrams twice a day. The dose can be gradually increased based on the patient's response, with maintenance dose typically ranging from 120 to 240 milligrams per day, administered in divided doses.
I see. And what are the common side effects?
Some of the common side effects include fatigue, dizziness, lightheadedness, gastrointestinal disturbances such as nausea, vomiting, and diarrhea in cold extremities. Bradycardia or slow heart rate and hypotension can also occur. Less common but serious side effects can include bronchospasm and exacerbation of asthma.
I see. Are there any contraindications?
Yes, it's contraindicated in patients with asthma or chronic obstructive pulmonary disease, bradycardia, second or third degree heart block, cardiogenic shock, and severe peripheral arterial disorders. But caution is advised in patients with diabetes and those with a history of severe allergic reactions.
And how should it be administered to achieve the best therapeutic effect?
To do that, it should be taken consistently, either with or without food, to maintain stable blood levels. Patients should follow the prescribed dosing schedule and not abruptly discontinue the medication without consulting the healthcare provider due to a risk of rebound hypertension or angina.
I see. And can it be used during pregnancy and breastfeeding?
Propranolol is classified as a Category C drug for pregnancy, meaning risk cannot be ruled out. It should only be used if the potential benefit justifies the potential risk to the fetus. Propranolol is excreted in breast milk, so breastfeeding mothers should use it with caution and under medical supervision.
I see. What drug interactions should you be aware of with it?
Propranolol can interact with several medications, including other antihypertensive, causing like additive hypotensive effects, antiarrhythmics, digoxin for heart, and drugs that affect liver enzymes, such as cimetidine, which increases propranolol levels. It can also mask low blood sugar symptoms in diabetic patients taking insulin or oral hypoglycemics.
I see. And how does it affect patients with diabetes?
It can mask the symptoms of hypoglycemia, such as tachycardia and tremors, making it more difficult for diabetic patients to recognize their low blood sugar levels. It can also potentially alter blood glucose levels. Diabetic patients should monitor their blood sugar levels closely and consult their doctor for management adjustments.
I see. Last question. What should patients know about the risk of abrupt discontinuation?
Abrupt discontinuation of propranolol can lead to rebound hypertension, angina, or even myocardial infarction in patients with coronary artery disease. It's important to taper off the medication gradually under the guidance of a healthcare provider to prevent these adverse effects.
All right. Thank you so much, Sadaka. Have a great day.
Have a great day.